So today we have a case of a middle-aged woman with knee joint pain. On MRI, she was found to be having mucoid degeneration of the ACL, and there was a complex tear involving medial meniscus, posterior horn, and body. On standing X-ray, the joint space was good, so it was not a case for any replacement surgery. So in this case, because of the mucoid degeneration, the ACL size increases, and this leads to impingement, especially on the terminal movements of the knee. So this impingement has to be taken care of with the help of debulking of the MCL, which you can see I am doing with the help of arthroscopic shaver. So we are going to debulk the ACL so that it doesn't impinge in the intercondylar notch. I am also going to use arthroscopic punch to do this. Now I have changed the portal, and now I have introduced my arthroscopic shaver from the anterolateral portal. Sometimes if the tissue quality is not good, we remove the ACL in its totality, but still not all of the patients will face instability. And if patient's lifestyle is active and in a slightly younger age group, we also would like to do ACL reconstruction after debulking of the ACL. In this case, the lifestyle of this patient is not that active, so we are not going to do ACL reconstruction, and we are just going to do ACL debulking. So this completes arthroscopic ACL debulking for the mucoid degeneration of the ACL. And now as we go in the medial compartment of the knee joint, we are going to encounter the medial meniscus, posterior horn, and the body tear. So this is a picture after we have cleaned the frayed cartilage over the medial femoral condyle and the proximal tibia on the medial side with the help of arthroscopic shaver. And now we are gently debriding or removing the inferior lamina of the torn medial meniscus, posterior horn, and the body. It is mainly horizontal tear involving the posterior horn of the medial meniscus. However, as we go towards the body, there is a component of oblique tear, so this makes it a complex tear. So after using the arthroscopic punch, I am going to introduce arthroscopic shaver to take out all the loose debris of the torn medial meniscus. And once we do this, we are going to repair this tear with the help of all inside device. You can see that the joint is quite good, so our meniscus repair procedure is going to definitely give some more years to this knee joint before the patient might require knee replacement surgery in future. This patient didn't need any high tibial osteotomy like surgery for correction of the deformity. Based on the scanogram, there wasn't much of a varus deformity. So now I have introduced my all inside device from the anterolateral portal. I am going to take bite from the anteriormost portion of the tear, and as I pierce the superior capsule with the help of all inside device, I am going to deploy my first implant. And now I am going to pierce the inferior capsule, and I am going to deploy the implant. Both the implants have been deployed, and now I'm going to pull the suture to tighten the knot, and this completes our first suture. I'm going to cut my suture with the help of knot cutter. Before that, I have introduced my arthroscopic probe to correct the alignment of our suture, and now I've cut my thread, so this completes our first stitch. Now I'm going to repeat the same steps 1 centimeter or half centimeter posterior to our first stitch. So as you can see, I have again pierced the superior capsule with the help of all inside device. I have deployed my first device, and now I am going inferior to the meniscus, and this is going to be my second implant. The second implant has been deployed, and now I'm going to pull the thread to tighten the knot, and once I do that, the knot is tightened, and then I'm going to cut my thread. So this completes the second stitch. Now I'm going to change the portal, I am now viewing from the anterolateral portal. I have introduced my all inside device from the anteromedial portal, and now I'm going to introduce again the device superior to the meniscus. As you can see, my assistant is giving valgus stress test, and all this procedure is being done after we have done MCL pie crusting. So now the second device is being deployed, and this completes the third stitch. And as I'm tightening the stitch, this is going to reduce the meniscus. You can see that the root is intact, so we don't need any root repair in this patient right now. And we are going to cut the thread, and this is going to complete our three stitches that we have used to repair this meniscus. So this completes the procedure. We are going to keep the patient non-weight bearing for 1 month duration, and we are going to allow knee bending up to 90 degree till 1 month. After that, in next 2 weeks, we are going to allow full knee bending, and we are going to start full weight bearing after 1 month. And this surgery is going to provide few more years to the knee joint of this patient, and the patient might not require knee replacement surgery for many years now. And obviously the symptoms with which the patient presented to us is going to be taken care of with the help of mucoid degeneration, ACL debulking, and the meniscus repair that we have done. Thank you for watching this video. Do like and share the video. Subscribe to the channel. If you have any queries, you can ask in the comment section. Thank you.